Dr. Schweik, thank you for joining us today to talk a little bit about mood disorders and inflammation or chronic illness. One of the reasons that I was thrilled to have you have a conversation with me about this topic is because I know as a medical doctor, one of your areas especially, or your area of specialty, what you're known for is really complex cases where inflammation or virus, bacterial insults are at the root of what you're seeing in your practice. And I would love today if you could share a little bit about a complex case maybe where you saw a real impact to the nervous system and the mood. Maybe somebody had Lyme, or maybe one of the PANDAS cases where you started to think and address the inflammation and notice a real significant shift in mood.
Sure, absolutely. And anytime I see a patient with mood disorders or anxiety or trouble with sleep, I'm always curious as to what the underlying triggers for that could be. And in the vast majority of cases, there are imbalances that can be addressed, analyzed, tested for, addressed, and independent of simply calling it depression and treating it with
Exactly.
SSRI, for example. The fact is that the human organism is incredibly complex, and the interplays, for example, between the gut and the brain, or if there are hidden infections, interplays between those infections and the brain are remarkably diverse and remarkably intense. For example, with tick-borne infections, one of the big red flags for me is somebody who has, for example, treatment-resistant depression or treatment-resistant anxiety, or a sudden onset of an anxiety disorder or a panic disorder where before they didn't have one.
Right.
And a gentleman comes to mind, a 54-year-old man who had some significant health issues but never had an anxiety component, and then out of the blue develops this severe anxiety, shortness of breath, panic disorder, and went to his psychiatrist and was prescribed multiple different medications, antidepressants, benzodiazepine medications, with some blunting of the symptoms, but did not resolve them. And when he came to see me, I tested him, and we found a extremely high elevated titer to Babesia, Babesia microti. On the West Coast, we also see Babesia duncani. And it's well described in the literature as well as the clinical experience that Babesia as an infection can manifest with anxiety, shortness of breath, sweats, panic, etc. We began treating him, and within the first, I would say, 1 to 2 months, he's not back to perfect yet, but pretty quickly we're able to decrease his symptom load, get him off of some of the other medications that he was on, it's such a compelling thing to me because had this guy not seen somebody who had that in their back of their head about, okay, one of these infections could possibly be doing this, he would basically be going down a road of more and more psych meds.
Exactly.
And with very poor control over his symptoms.
Yeah, and it's definitely one of the impetuses for me to get the dialogue going in my own profession, and also between healthcare practitioners, because I know from my arena, we study the DSM, we're well versed in the DSM, and things that could have a biological underpinning coming from an immune insult oftentimes might be categorized, if they went down a behavioral medicine pathway, as a mood disorder or anxiety attacks, when we know that there's a deeper root cause there.
Right.
And so my hope is that unfortunately, as people become sicker, we also need to be pushed to find more solutions, and collaborative medicine seems important.
The field which you're discussing of the crosstalk that exists between the immune system and the brain is super fascinating and super dynamic at this point in time. The research literature that looks at the status of the gut and the microbiota, the microbiome in the gut, is really exploding right now with discussions about the effects that has on the brain, and then conversely the effects that the brain has on the gut. And so there's this crosstalk, this bidirectional flow of information. And even if someone is presenting with a purely psychiatric disorder, it's been clearly shown that any work you do on the gut or on the gut immune system or on balancing that aspect of the body has really profound effects on the brain.
Absolutely. So I think as we progress forward in medicine, the walls might have to come down between immunology and
Right.
behavioral medicine and
Intermingled.
complementary. Exactly. And again, in the world that I'm coming at it from, is I'm seeing all of these new novel drug approaches, which again, they see they're working and they know there's an immunological component, but the collaboration, I think, is still at only the threshold of, I think, where it's going to go in the next 5 or 10 years.
We have to resist the urge to try to find that one drug that is going to quote unquote fix it. Because for some patients, for some subset, it'll help. But really, the more broadly we look and the more different body systems we work on simultaneously, the better things will do.
Absolutely. Well, thank you for the great work you're doing with patients, Dr. Schweig, and thank you for joining us today.
It's been my pleasure. Thank you.
Thanks.